in my practice, a lot of my clients are often surprised when I start talking to them and asking them about their birth experience. Generally, they come to me when their children are slightly older, 3 or 4 years old, and they want to talk about the problem that they're experiencing at the moment. But that birth experience, if there was some trauma, it might actually have relevance on what you're seeing at the moment, and that's why I ask. So to a certain extent, birth is a traumatic experience. Even if you have a normal, totally non-eventful birth, your body is going to release a lot of stress hormones. And those stress hormones are important because they initiate the release of other feel-good hormones later, which is going to be important for healing and for bonding. The truth is, though, that a difficult traumatic birth experience can have lasting effects, and we need to be aware of what these might be. Practically, we know that if there was a medical emergency during birth and baby had to be removed from mom either for her treatment or for baby's treatment, that can have an impact on the early bonding and building a good attachment relationship. As far as it affects moms, we know that many moms who experience a traumatic birth, they have these intense recollections, very vividly, of feelings of fear sometimes. Sometimes they report helplessness or complete horror. They might experience irritability, they might be hypervigilant, they might feel anger, and some women go on to develop post-traumatic stress disorder. And that's something that we want to try and prevent. So if you've had a difficult birth, it's perhaps important to talk to somebody about what you're experiencing and how you're feeling. In severe cases, we find that some women might completely avoid intercourse, just in case that could lead to a further pregnancy. So very important to think about that. Initially, there's also this heightened concern about the baby's well-being. So it might cause mom to live in this constant fear about how her child is doing. Is her child well? Is it okay? And that transfers through into early childhood. We know sometimes it's not very good for kids to be monitored and checked and to make sure that they're 100% okay all the time. So moms might become a little overprotective. Also, some women report that they have feelings of personal failure. They feel that their body should have done better than they actually did. And as an interesting spin-off, sometimes we find that there's conflict between the two parents when there's been a traumatic birth, because one parent might have been feeling very stressed, or possibly both, and those feelings of stress can sometimes create anger and frustration and have them butt heads a bit. When we look at the impact on the baby, we know that the baby's brain hasn't really developed well enough yet to actually analyze the situation and to rationalize through it. So here they get to this very stressful situation. It's unfiltered, unprepared, and it might have quite an impact early on in how they experience the world. Early trauma can impact on a child's neurological development. The way that our bodies react physically to stress actually has an impact on brain development and what happens within the brain. And very often we find that those early brain sort of impacts and what happened initially can carry through into adulthood, and it might have an effect on how we respond to stress and respond to trauma later on in our lives as adults. Depending on exactly what kind of trauma the mom or the baby experienced during stress, we might also, during birth, we might see that might have an impact on their future interaction, how the child develops, even academic development for the child later on. The most difficult thing, I think, with babies is that when there's been a traumatic experience, they don't have the language skills to tell you what it is that they're actually going through or feeling. So some of the things that you could maybe look out for is if there's just inconsolable crying, your baby doesn't stop crying, they cry without any apparent cause, that might be a sign that there was a traumatic birth. They might be hypersensitive to touch, and they might not want to really be held. They might be quite aversive to affection and to love. And then I think something we often miss out on is the effects of a traumatic birth on dad. Dads are also a very important part of this picture. And here you have dad, and he might realize that something's going wrong, there's some trauma, and he's worried both about his wife or his partner and his baby, and quite often all the attention is on everyone else, so they have very little support. The emotions are already riding high. I mean, here's this moment of all sorts of different emotions. You're elated, you're concerned, and there's so much expectation of them to be this strong tower of support and to be there for everybody else. But it might really impact on them, and it's important often for dads to have somebody with them or close to them to support them as well. And then the worst thing is that I find that quite often if there's been a traumatic birth or there's been some trauma just after birth, we look after mum, we look after baby, and as soon as visiting hours are done, we send dad home. And here he goes home all by himself. There's often very little sort of comfort for him at home. He doesn't know how things are going with mum and baby. So if at all possible, try and remain constant contact so dad can at least know what's going on and how you are. It might also impact on dad's transition to fatherhood. You can understand that when a husband or a father is very much in love with his wife and he's worried about her concern, it might be a little bit difficult for him to accept this new role into fatherhood where the baby that they had together might have impacted on mom's health or actually been a threat to her health. So it might take a little time for dad to get used to this idea of being a father and also bonding with a baby. So trauma happens. What do you do when you've experienced trauma? What do you do to try and help with that? So the most important and probably the most simple thing is that just talking about it can sometimes have a big effect. Try and find somebody who's sympathetic to what you're going through, perhaps someone who's a mental health professional that has the skills to guide you through this, and someone who will really listen and let you just talk it all out. It's important to remember that every single birth is different, so try not to compare your birth with someone else's, especially where we see those feelings of mom where they feel that they've failed in their birth process. There's no such thing as a perfect birth. Your birth, if you have a beautiful, happy baby, there you are. Make sure you have lots of loving support, and then try and get stability and predictability established as soon as you possibly can after birth. It might be a little bit difficult if there's medical things that need to happen. Perhaps your child needs to go into hospital quite often. Perhaps there are injections or medication that need to be given. But as soon as you can, try and get back to a calm, relaxed environment with predictability so that we can now start working with that trauma and get away from it.